live Sunday at noon Eastern on Book TV's In Depth on C-SPAN 2.
Washington Journal continues.
This is Congressman Peter Welch. He's the Democratic representative at large for the state of Vermont. And we were just talking, amazingly, his very first visit to C-SPAN's Washington Journal. So welcome.
Good to be here.
Our viewers are happy to see you, and so are we. Thanks.
Thank you.
We're talking health care, and we just heard that on an interview this morning, Congressman Bart Stupak said that he and 11 other Democrats who have been part of the coalition concerned about abortion language will not vote for the bill if it continues to contain the language. I put that out as a question. What kind of challenges does the Speaker Pelosi have in getting a bill to the floor and getting it passed, in your estimation?
Well, huge challenges. The political challenges are immense, but she's determined to proceed, and I think that it's time to call the question. We really do have to make a decision as a country as to whether we're going to move to a health care system where all of us are covered, all of us help pay, and where we try to transform the delivery of health care from the volume-based fee-for-service approach to a much more value-based where you get good outcomes.
If this legislation passes, give us a scenario 3 to 5 years down the road. How will the country's healthcare system be different?
Well, first of all, the question is really very good in focusing the fact that this is a beginning. If we pass this legislation, it's not as though we're going to overnight transform the healthcare system. People are going to be able to go to their doctor, they're going to go to their hospital, and that'll continue. But what this healthcare will do is basically say that all of us, all Americans, have to be in a healthcare system. And, you know, you can't be successful in healthcare unless everybody is covered, all of us help pay, and then you begin making these system changes that many of our hospitals and our doctors have been calling for. Simplicity in the billing system, rewarding hospitals that focus on managing chronic care, things that are very expensive in the health care. So I think what you'll see if we pass this legislation is that it's the beginning, and it will unleash the capacity through incentives that make sense for us to have a much better value-based healthcare system. You know, the big problem in our healthcare system right now, among other things, one, over 45 million Americans with no coverage, and two, it's 17% of our economy. And of course, our competitors, it's only 9 or 10%. So it's a huge economic burden on our businesses, on our middle-class families. And the dynamic in the current system is really led by insurance companies. Their goal is to return profit to their shareholders. And what that results in is them avoiding risk. If you're healthy, they want to insure you. If you have a pre-existing condition, you're old, or you may get sick, they don't. So you have this cost-shifting dynamic in our present system that simply isn't sustainable. We pass this healthcare system, and I think we begin to change the dynamic.
This morning, the Wall Street Journal has reproduced in its entirety the comments that Congressman Paul Ryan made at last Thursday's Healthcare Summit. It's really on the costs overall. And in this, you probably heard it, but he talks about the analysis from CBO and how the bill actually doesn't report the real costs, essentially coming to the point that it'll break the bank if we pass this legislation.
See, yeah, I disagree with that. The referee that Republicans and Democrats have to look to is the CBO. And the CBO has scored the House bill, and it will reduce the deficit by $100 billion over the next 10 years. What we know is that status quo will bust the bank. Now, there's a lot that we can do better, but if we don't take this first step, the status quo will rule. And just think about what's happened in the past 2 weeks. In California, the Blue Cross plan out there asked for a rate increase of 40%. Think about what that does to a small business, to a middle-class family. It means they can't afford it, they dump the coverage, or they get really inadequate coverage. So that's the status quo, and we can't accept it. It doesn't work.
Well, even though you haven't been here before, our viewers have been talking about healthcare for a year. They're primed and ready for you. Before we start this first call, would you spend a moment and talk about your separate legislation on negotiating prescription drug coverage for Medicare?
Sure. There's over 60 of us in the House who sponsored legislation to basically allow the government to negotiate wholesale price discounts when we're making bulk purchases. You know, it's a pretty astonishing thing in Medicare that we buy wholesale but pay retail. And if we pass this legislation and negotiate prices, just like you would if you went into the pharmacy and you bought 100 aspirin, you'd pay a lower per unit price than if you bought 10. We want the taxpayer to be able to do that. it would save the American taxpayer $156 billion over 10 years. And it makes no sense whatsoever that we abide by what was a Tom DeLay effort that gave the drug companies the right to dictate what prices the taxpayer would pay. So this is something that would save money and I think give people access to the drugs that they need.
As a corollary, do you also support drug importation from Canada?
I do. Yeah, it's competition. You know, the drug companies do two things. One is very good. They create life-saving, pain-relieving drugs. The second is not so good. They price gouge. So you have competition where the government, when it's purchasing, can negotiate prices, or they have to compete as long as those drugs are safe with other manufacturers. That's going to drive down prices and give the consumer a little relief.